Methacholine is an acetylcholine analog and a non-selective muscarinic receptor agonist that really has no practical therapeutic application. Instead, we use inhaled methacholine to diagnose bronchial hyperresponsiveness, which we see in asthma, and to a lesser extent in COPD. If the FEV1 drops by 20% or more with an inhaled methacholine concentration of 4 milligrams per milliliter or less, then that is considered a positive test for airway hyperreactivity. This graph shows the methacholine challenge for a 63-year-old white female non-smoker with shortness of breath. On the x-axis, you can see the methacholine dosing concentration. You can see that her FEV1 clearly drops by greater than 20% from baseline when she reaches 1 milligram per milliliter, which would make this a positive test. So how are the results of a methacholine bronchial challenge test helpful? Well, the test is pretty sensitive. Remember the mnemonic SNOUT from biostats? This reminds you that sensitive tests rule out. So if it's negative, it essentially rules out asthma. But it's not very specific. The mnemonic from biostats there is SPIN, where specific tests rule in. A specific test can help you rule in a diagnosis, so here if it's positive, you can include asthma on your differential, and may even make the diagnosis with the right clinical context. But you have to worry about false positives, because other conditions can give you a positive test like smoking, URIs, allergic rhinitis, and GERD.